really need the state and the federal systems to recognize our free and charitable clinics as a true healthcare solution. Funding is going to be challenging always. The growing demand with our patients is especially being seen in the chronic care area. So those that have diabetes, hypertension, COPD, other heart conditions, CHF, AFib, they are in need of not only primary care, but specialty care.
The cost of providing care has increased tremendously. The cost of medical supplies, medication costs. Our patient population has doubled since the pandemic, so this is a very challenging time for our clinics.
We need funding. We need for our government to recognize the level of care, the amount of care, the quality of the care that we're delivering, and for them to understand the value of what happens if we go away. I hate to say it, there's not a whole lot we couldn't fix with more funding. I just worry if we don't get more funding, I don't know how much longer we can sustain over time, even those of us who've been around for 54 years, because we're just in a different world right now. And a lot more needs, a lot more mental health needs, public health needs, and a huge diverse populations that we're seeing.
Without our clinics, the burden, the financial burden on our healthcare system is going to be very, very significant. The wraparound services that we give help to keep the patients out of the emergency department, help to decrease 911 calls, which we've seen at our clinics, help to decrease recidivism in the hospitals. So essentially, we're decreasing the burden, the financial burden to our healthcare system in Virginia.
Without the funding and helping people to really keep these doors open, I fear for what happens, not just for low-income folks, but what that impact on the larger community is going to be in terms of health going down in general.